Namaste and welcome to 10th episode on Nursing Officer with Pratiksha Bhandari. Under nursing concept and principles, today we'll be discussing on stress management. We'll be seeing about stress, classification of stress, causes of stress, effect of stress, body response to stress, and management of stress finally. In general, stress is like pressure, strain, tension, worry, anxiety. When a person is in stress, there is the disequilibrium of the homeostasis, and it is a state produced by change in environment which is perceived as challenging, threatening, or damaging to the person's dynamic balance or equilibrium. And stress is a non-specific response of body to any demand made on it, according to Hans Selle, 1936. Stress can be classified as eustress and distress. Eustress is the positive stress that promotes the growth and accomplishment, like meeting a challenge, coming first or winning, getting promotion, marriage, buying a new house. This is a eustress that focuses on growth and accomplishment. It is also called good stress or positive stress, while distress is a negative stress, and it occurs when level of stress is too high and the person's body or mind begin to respond negatively to the stressor. For example, you can see divorce or the death of a spouse, losing contact with loved one, death of a family member, and hospitalization due to some sickness. And there is another classification of stress, that is acute stress, chronic stress, and traumatic stress. The acute stress is so common and it is easily recognizable form of stress. It happens all of a sudden, like sometimes we are stressed through noise, isolation, crowding, hungerness, and stress before giving speech. These are some examples of acute stress. Similarly, chronic stress, it affects physical and mental health of individual day after day and year after year, like marital conflict and work stress. This falls under chronic stress, while traumatic stress is a severe stress reaction that result from catastrophic event or intense experience, like natural disaster, sexual assault, life-threatening accident. And many times we hear about post-traumatic stress disorder. It occurs due to traumatic stress. And here are a series of 12 steps of post-traumatic stress disorder. In most of the cases, after so many trauma, some might gradually begin to recover, but some people, there is a psychological and physical symptoms which are triggered by the trauma that doesn't go away, and body doesn't regain the equilibrium, and the condition is known as the post-traumatic stress disorder. Okay, stressors. As we discussed about stress, stressors is that which produces stress, and it can be classified as internal stressor and external stressor. The internal stressor is the one that originates inside a person, like pregnancy, menopause, emotions, thoughts, and feelings, while the external stressor, it originates outside the person, and it could be physical, that result from physical symptoms, or psychological, that arise from time pressure and unrealistic expectations. Similarly, financial stress that occurs in absence of job and when one cannot repay loan, medical cost, and school fees. And social stressors to occur, which are so abundant and can occur in any context where there is the interpersonal relationship, like school, workplace. Moving to effect of stress, as we see, the physical stressors that causes the physical stress and causing multiple disbalance in the equilibrium in like metabolic disorder, skin disorder, respiratory disorder, cardiovascular disorder, gastrointestinal, musculoskeletal disorder, menstrual irregularities, cancer, decreased immune response. And as we see, psychological stressors that could cause emotional effect like anxiety, fear, depression, accident proneness, suicidal thoughts and attempts. And there could be some intellectual effect which hampers the person's perceptual and problem solving abilities, and the social stressors causing the social effect which alter person's relationship with others. And there are some spiritual effect which challenge one's beliefs and values. When there is some stress, through some stressors, there are physiological or psychological response by the body. And for physiological response, our body do response through flight or fight response. So body prepares for survival and maintain equilibrium through automatic adjustment with the help of medulla oblongata, reticular formation and pituitary gland. And while responding in a physiological way, the body reacts to stress either locally or in general way. When there is some local stress, the body adapts locally, and in general there is general adaptation syndrome. For local adaptation syndrome, it adapts locally for inflammatory response and pain response. And there are 4 characteristics of it, that is localized adaptive response, there is short-term response, and there is restorative response. But in case of general adaptation syndrome, the body goes through 3 stages which moves in order like alarm stage, resistance stage and exhaustion stage. We make mnemonics like ARE in order: A for alarm stage, R for resistance, and E for exhaustion stage. The alarm stage is the instant, short-term, life-preserving and total sympathetic nervous system response when the person consciously or unconsciously perceives stressors and feels helpless, insecure or biologically uncomfortable. The resistance stage, in it the pituitary stops that large secretion of hormone and the effect of alarm lessens. While in exhaustion stage, it occurs when the person couldn't balance the equilibrium and there is not ability of body to continue to adapt to internal and external environmental demands, then the exhaustion stage occurs. There are physiological and psychological changes in alarm stage, release epinephrine, norepinephrine. There is vasoconstriction, increase in blood pressure, heart rate, respiratory rate, hormonal level and size of adrenal cortex. There is increased level of alertness and anxiety. The person is task oriented if the stress is eustress, and defense oriented maladaptive behavior may occur in case of distress. Increase the use of coping mechanism. In resistance stage, the hormonal level readjust and the adrenal cortex, which increased in size during the alarm reaction, decreased in size, and the lymph glands return to normal size in resistance stage, and there is tendency to rely on defense oriented behaviors. Exhaustion stage occurs when the body couldn't regain equilibrium in the resistance stage. So there is the decreased immunity and there is depletion of adrenal gland and hormone production. The body shows physical symptoms like weight loss, enlargement of lymph glands, and there is dysfunction of lymphatic system, and the continued exposure to the stressor may cause death. There are some psychological changes like disorganization of thinking and personality. Reality contact may be reduced and delusion, hallucination might occur, and violence may occur if continued exposure. These are the changes seen in alarm stage, resistance and exhaustion stage in general adaptation syndrome. we discussed the local adaptation and general adaptation syndrome, and under that we saw some physical, physiological and psychological changes and response, and focusing only on the psychological response, there could be some task oriented behavior and ego defense mechanisms for body to respond to stress. For managing stress, there should be adopting the right attitude, and it could convert negative stress into positive one. In times of great stress and adversity, it's always best to keep busy, to plow your anger and your energy into something positive. It is according to Lee Lacoca. Okay, we're discussing mainly on the stress management, and being a nurse, we could determine which client seem as stressful and how stressful is the event to that client, and we can also assess how the client has coped previously to such stressors, so that we could solve easily this time. And we should provide support and encourage family visits and listen the concerns of client, pastoral and social services, and provide control, maintain client independence, allow client to make choice concerning timing and sequencing of activities. And we could provide information, answer question, provide information about procedures and events. We should recognize clients' feelings and support clients' own coping strategies. In general, stress management could be done through adopting a healthy lifestyle, adequate rest, enhancing coping strategies, self-awareness, support system, positive thinking, spirituality, that is holding on beliefs, and appropriate time management, recommending support and group therapy. Also, there are some advanced technique of stress management like biofeedback technique, progressive muscle relaxation, meditation, guided imagery, autogenic training, relaxation therapy, massage and therapeutic touch. These are some advanced technique of stress management. Here we would be discussing from this slide about if there are any MCQ related to that portion. We will be discussing some sample MCQ in the same slide. Moving to question number 1. Stress is a non-specific response of the body to any demand made upon it. It was covered in slide. The answer is Hansele. Question number 2. Body adapts to stress passing through a series of following stages. Okay, as we discussed, there in general adaptation syndrome, alarm stage, resistance stage and exhaustion stage. Question number 3. Stress is high enough to motivate the person to move into action to get things accomplished in. In types of stress, there were acute stress, chronic stress, traumatic stress, and in another classification there was eustress and distress, and the eustress is the one that helps to motivate the person for accomplishing goals. Question number 4. Which of the following is a cognitive symptom of stress? Okay, cognitive related to thinking and concentration, and the correct answer is difficulty in concentration is a cognitive symptom of stress. And it's all about stress management, and we'll be discussing about burnout syndrome in the 11th episode. Thank you for watching, and I'm so thankful to you all. Subscribe us for getting notifications to our updates. Thank you.